So actually, we're expecting around, no, so we are actually attended by the following schools this morning na maayong butag sa tanan. So we have here from MMFC or Mindanao Medical Foundation College. Good morning, dear students, and also, okay, and also we have from St. John Paul II College of Davao. Good morning, dear students. And from the Corheso College, Indigo City. Good morning, everyone. Respective coordinators as well. So I think this would be a quite big group, no? Because actually, aside from that, no, aside from those schools that I have mentioned ago, we're also being attended by San Pedro College, no? Sa kabila sila na virtual platform, no? Of course, with this, we'll be having our virtual orientation for today. So there will be two parts po, no, dear students. So firstly, we'll be, of course, provided with the IPC protocols and policies to be given to us by Mr. Jason Gray, Doctor. And of course, to be followed by the affiliation policies and procedures here in SPMC to be given to you, yours truly, Mark, no? So later on po, so we'll be catering questions as well. So you may key in your questions sa chat box natin and also, or you may manifest later on. So you may manifest later on. So you may manifest later on sa ating virtual platform so that you'll be able to, of course, kwan your concerns, no? I-raise yung mga concerns nila later on as we go by with our lecture. So also, do not forget to kindly also click or tap on the link provided po sa link sa ating chat box for the attendance today. No, kailangan talaga ninyo makapag-attendance because aside participants to complete your certificate of attendance, which is actually part ng inyong requirements dito sa ating virtual orientations. But okay, so let's keep the ball rolling. Let's start our orientation. Or our let's hear some few words.
Good day to the nursing clinical instructors and nursing student affiliates, and a warm virtual welcome to the Southern Philippines Center Pedro Future. As you embark on this important, we aim to equip you with the knowledge and proper mindset as you begin your clinical related learning experiences with us. This is an exciting as well as challenging time for you to step into the world of healthcare through the patients. All you will encounter in our institution. Your knowledge and skills honed in the respective schools still train. Hope that you will continually see to ensure that the skills you will learn follows quality and safety protocols. Since we are dealing, we hope also that beyond learning from our patients, you will develop a deeper sense of appreciation for them, sense of compassion and dedication to make a significant difference in their lives. Take full only with our patients, but with your peers and mentors, for they are the tools by which you will learn more. And hopefully, as you learn, you really impact our patients and serve them the best way you can. We ask also the clinical instructors to join hands with our staff to process your learning experiences and give you immediate feedback. For as they say, feedback and evaluation drives learning. Throughout this orientation and your clinical rotation, we enjoin that you ask questions, seek guidance, and immerse yourselves fully in the learning experience because this is the time you should do that. This is just one of the steps in your long journey as future nurses, and we hope you learn as much as you can to ensure that the Filipino nurses continue to be one of the most sought after the world over. But as you listen to our patient stories, we hope it will motivate you enough to stay and serve our countrymen. Once again, welcome to the Southern Philippines Medical Center and your nursing affiliation. Let's make this ARC Andrada a foundation for your future success. Thank you and welcome once again.
Thank you very much, ano, those were special focus to become future nurses and midwives as well, right? So yun, you know what I mean na country and maybe soon, no, you'll consider working here in SPMC. Di natin alam, no, in the future. So with that, now let's start with our orientation this morning with the IPC protocols to be given to us by our IPC lecturer, no other than Mr. Jason Gray, doctor. Thank you.
To begin, I'm going to cascade to you today our SPMC infection prevention and control guidelines. First of all, I'm going to kick this one off by giving you our objective. So by the end of this virtual orientation, you as our consensus participants would be able to first and foremost be cognizant with the pivotal elements of IPC as deterrents to infection. Secondly, adopt the principles of infection prevention and control to inhibit disease transmission. Third and last, be acquainted with the policies, protocols, both of the hospitals and of course to our isolation facilities. And that is all for our objective. Up next, we have our preventive measures here in the hospital. So definitely as we begin, of course, everybody has to wear their primary PPE, and that is our respirator or our medical grade mask. And why is that so? It's because SPMC is still a COVID facility here in Davao City, not only in Davao City, but of course of the entire Mindanao. And since we are still catering COVID-19, so we have not put down this implementation. Instead, we retain this one for everybody's protection. But definitely there are still other, let's say, PPEs of which wash our hands with a of soap and water. And alternatively, if there is, let's say, accessibility to as to whether it is unclean or clean, you need to wash your hands for protection purposes. Number four is, of course, we maintain physical distancing of 4 meters, or let's say 6 meters, 2 meters rather. Now, when it comes to physical distancing, sometimes this is not that feasible for the most part. It's because when we are nurses, we are med techs, we are, let's say, midwifery students, most of the time we always get to have contact with our patients, especially when we do our health assessment, we perform certain procedures. Sometimes maintaining a specific proximity is not feasible, but of course, does not if it does not permit us to maintain 2 meters distancing, might as well wear your proper PPE for our protection. Okay, so that is our let's say our leeway if we are not, or if we cannot maintain our physical distancing for that matter. Number five is, of course, one water policy. So this is actually a long time policy now of SPMC, that we do not allow families to aggregate inside patient's room. Instead, we only allow one watcher to be inside patient's room. And most of the time, these watchers are families, relatives, or a friend of the patient. So similarly, if we are having our clinical exposure in the clinical setting, at times when students are going to have their case presentation, please be reminded that you are not allowed to aggregate inside patient's room. And if you truly wanting to have a personal contact, or let's say physical assessment with your patient as part of your case presentation, please do it one at a time. We do not allow people or students of microorganism comes in if that is taking place in the clinical setting. All right. Number six is, of course, what we have here is travel restrictions. So nowadays, double seating is quite loose when it comes to travel restriction. And why is that? It's because COVID-19 is decreasing, but definitely we should not be very complacent about it, because COVID-19 is still endemic. People are still infected with COVID-19, especially for those individuals who are not vaccinated. So here, if our students or if our athletes from Davao, then definitely you can do that. Just make it sure that every time you come back to SPMC, you are not bringing in diseases that would cause outbreak inside the hospital, or that would cause and foodborne diseases sometimes arises. Like symptoms or flu in itself, or as a disease, is sometimes existing, leptospirosis and dengue. So for that, of course, if you are having, let's say, signs and symptoms of any other diseases, please do inform immediately your clinical instructors that you are not feeling well, because we wanted to make sure that if you are sick, you will not be the engine that you will be transporting microorganism to our patient, especially if our patient is, let's say, in critical condition. Of course, we don't want that one to happen, because we don't want to be the reason of our patient's demise. Next is, of course, clean as you go. So definitely, since we are part of the end user of the hospital facility, it is highly implemented that once we make use of our hospital facility, everybody must maintain cleanliness. So meaning to say, we are not allowed to leave or litter our rubbish in the clinical setting. And if you're assigned to that area, it is your responsibility to keep all your rubbish. And of course, part of that is you need to identify where are you going to dispose them. So definitely, we have provided all clinical areas about our different types of rubbish. So we have there our bio, the non-bio, the infectious, especially for our sharps and needles. Of course, students, if you are using, let's say, parenteral injections, please do know where to dispose them for protection, not only to yourself, but everybody working in the hospital. All right. Next is, of course, we have to reiterate that no eating together is still implemented in the hospital, because most of the time when an individual, or let's say your colleague or your friend, is, let's say, a carrier of a disease during incubation period, and if you have not known yet as to whether that person is infected or not, if you are exposed to that person to approximately 3 to 5 minutes, you can already acquire the disease. So that is the value why it is always reiterated the no eating together. Social gathering is also one point that we need also to consider, because when people aggregate inside the hospital without, let's say, reasonable cause, sometimes this is the source of transmission and infection. And not only that, sometimes spread comes in when these people gather around. So here in SPMC, we only allow social gathering once it is permitted. Like, for example, post conferences with nurses, doctors, midwives, midwifery students, and others. Okay. During endorsement, yes, we allow them to to do social gathering. It's because you are receiving patients' endorsement, provided that every time you do this, you maintain and go back to principle number one, and that is wearing our medical grade mask. Next, of course, we need also to recognize and to know that the hospital is under three color codes. So we have here the red, the yellow, and the green, following the traffic lights. So this can give us signal, or let's say significant information here in the clinical setting. Now, when you see green or green zone as part of our signages in some areas, or let's say entry points, please do take note of them, because when we speak about of green, it means to say you are in non-COVID facility, meaning to say you are in a safe zone, no transmission is taking place in that area. Yellow is actually the areas of which our COVID patients are being dropped off, and sometimes these are the areas of which our patient having COVID are being wheeled or transported to their area of confinement. And when we speak about of red, this is actually the facility for COVID-19. So please do take note and recognize these signages for our safety and guidance. Last, of course, is, of course, if you are vaccinated, then well and good. And if you are not vaccinated yet, let's say you only have your primary series, might as well get your flu vaccine with you, your hepatitis vaccine with you, and your pneumococcal vaccine for your added protection. And that is it for our preventive measure here in SPMC. Up next, we have this illustration on your screen conveying about how long COVID-19 survive on various surfaces. So on copper, it can survive for about 4 hours. In an enclosed space without proper ventilation, it can survive for about 3 hours. Again, for stainless steel and plastic, for about 3 days and 24 hours on papers, cardboards, and students' affiliates. Please do take note, they can also survive on patient's chart for about 24 hours. So every time we handle our patient's chart, please do take note that you need to wash your hands. You have to remember that your health is your responsibility. All right. Moving forward, we have here our occupational safety. So as we speak about occupational safety, we are just plainly speaking about needle stick injuries. So this can sometimes occur in all areas of the hospital. So this really depends on the handler, how he take note of the proper handling and procedure of our parenteral injections. Most of the time, the reason for this is recapping of needles. Students, please be reminded that you need to practice no recapping of needles, because most of the time, this is the reason why people, or let's say healthcare workers, sustain injury, it's because of this wrong procedure. Now you have to take note that if this used needle is, let's say, inoculated with client's blood upon injection, sometimes it comes along with a disease that we do not know coming from the patient. And what are these blood-borne diseases that we're talking about? Definitely, this is our HIV/AIDS, our hepatitis B, and our hepatitis C. Now, let's take a look at now the statistics. Which of these three major blood-borne diseases is highly transmissible? Now, in 3 seconds, can you guess in your mind which do you think is highly transmissible? And if you say it's number three, then you are definitely correct. And why is that so? It's because your hepatitis B virus can survive for about 2 weeks or 14 days, whereas your HIV can only survive under a minute outside patient's house. But of course, we are not undermining that HIV is still highly communicable. Now, if somebody will be pricked with a used needle, what should we do? Definitely, we're going to wash our hands with soap and water, and you need to do the reporting within 24 hours. Okay, so you need to inform your clinical instructor, the unit manager in the area you are assigned, and then you have to come by to our office, IPCU, so that we can help you, we can assist you to have your treatment and prophylaxis for your protection, definitely. And of course, let us be reminded once again that we never recap use needle using both hands. Instead, what should we do? We do the fish hook method. Students, please don't forget about this because this is very important in your clinical practice. Up next, we have our health and safety reminders for everybody. So definitely know the client's diagnosis, because most of the time when we do not know our client's diagnosis, sometimes we do not know what to do in the clinical setting. And since we are still practicing how to develop our clinical eye, it is best to know first your client's diagnosis so that you might at least have some idea of what to expect from your client. And it is very important. By knowing client's diagnosis, however, it can also help you how to become cautious about how diseases can be transmitted from the patient to others. So that is the power of knowing everything about your patients first. Second is, of course, wear the right kind of PPE. So definitely wearing the PPE sometimes has some risk and some benefits of it. So let's take a look at that. So first, definitely we have this so-called low risk, followed by high risk, and of course, moderate risk. Once we speak about of low risk, these are actually healthcare employees. It can be staff or whatsoever, or it can be also affiliates. When we speak about of low risk, these are actually individuals wearing the PPE at the right time, at the right place, at the right condition. So meaning to say, you will not acquire the disease. However, as we speak about of high risk, these are actually healthcare workers exposed in the clinical setting in the absence of their PPE. So that puts you at this category called high risk. Moreover, as we speak about of moderate risk, these are actually individuals or healthcare workers wearing the PPE, but if it is not the right kind of PPE during the time that you handle this situation or your patient during the time of care, most likely you will be placed at moderate risk. Later on, I'm going to show you what are those specific procedures of which you need to wear the right PPE as this procedure are being done in the clinical setting. All right. For number three, of course, we need to wash our hands before and after each procedure. Okay, nurses, midwifery students, please do take note the 5 modes of hand hygiene. And I hope that we are not just only washing our hands every time we handle blood and body fluids of our patient, because most of the time people normally miss performing hand hygiene when they have to have their contact with their patients in the absence of handling, let's say, blood and body fluids for obvious reasons. All right. So again, Please be reminded that we need to wash our hands before and after each procedure, even if we are wearing our gloves. And why is that so? That is simply because our gloves is not 100% giving us protection, because once the gloves has been used, normally it sustains pores. So if that will take place, so of course there is now, let's say, some chances that microorganism can get into have, or let's say get into our skin. So might as well do perform hand hygiene every after using our gloves. Here we have are the procedures of which we are required to wear our N95, and these are our aerosol generating procedure. So here we have, of course, our swabbing, sputum collection, intubation, extubation, tracheostomy care. Now, for those nurses who will be assigned in ICU who will be doing this, so if you are not, let's say, confident, if the patient is, let's say, having a, let's say, communicable disease such as respiratory diseases of any form, and if you're doing tracheostomy care, please do wear N95 for security purposes, and of course doing suctioning even with nebulization. All right, but if you know the client's diagnosis is just only plain asthma, and if you're wearing, let's say, your medical grade mask, that would be okay. But if you do not know the client's diagnosis, might as well wear your N95. And of course, during emergencies, especially those students who will be assigned at the ER, so ambu bagging or doing code blue or CPR if you didn't know yet the client's diagnosis, then wear your N95. Okay, I hope this is very clear to everyone. Up next, we have our COVID-19 classification. Of course, this has remained unchanged for quite some time. So here on your screen is a table divided into 4 columns. So we have the group at risk, the signs and symptoms, the test, and of course, for its classification. So everybody working here in SPMC, regardless employees, athletes, or whatsoever, COVID or non-COVID, since you are all here in the facility, then all of us will become vulnerable to acquiring diseases, especially COVID-19. So definitely, we need to be careful. Of course, for signs and symptoms of COVID-19, it hasn't changed a lot. So it has remained unchanged for quite some time already. And I think these are, let's say, the signs and symptoms of COVID-19. And if you have signs and symptoms similar to COVID, not exactly COVID, for as long as it is similar, and if you are untested, and you will be called a suspect. But if you have tested yourself to a laboratory not recognized by DOH, regardless of the result, positive or negative, that you will be that will be belonging to a classification called probable. So that means to say that you're going to have your repeat testing. And of course, if it turns out to be RT-PCR positive, then you will be labeled as confirmed. Next, we have our SPMC admission procedure of the hospital. So first, so definitely as the patient arrive in the hospital, sometimes it can be through, let's say, ambulance, taxi, or let's say walk-in patients. Definitely as they enter to our ER or to our COVID isolation unit, they will be attended by our resident on duty, and they will be assessed for severe acute respiratory illnesses, for signs and symptoms, travel history, as well as of contact. And if it is very suspicious that there is likelihood of having, let's say, COVID-19 or similar diseases, then the patient will be given with our RAT or our RT-PCR testing. And if it turns out that the result is, let's say, positive, and if you are, let's say ambulatory, mild symptoms, non-progressing signs and symptoms yet positive, then the doctor might give you his decision that you will be going to have your home quarantine for 5 days. But if it seems that your condition is, let's say, progressing, non-abating, then somehow needs critical management, and most likely you will be admitted to the hospital, and you will be transported by our ambulance, because we do not allow patients who are positive with COVID to be hovering around, cruising the hospital vicinity during the time that the person is sick, because we don't want spread of microorganism to the people around the vicinity. So definitely you will be transported by our hospital vehicle to your area of confinement. All right. So that is it for our SPMC admission procedure here of the hospital. Up next, we have our transmission-based precautions. So this is just some sort of a review to everybody. So for airborne, we have here our table providing us the mode of transmission, the PPE to be used, and of course the common diseases that are encountered in the clinical setting. Now, for airborne, definitely we are going to make use of our N95 for droplet, our surgical mask. For our gloves, so we have for contact, we need to make use of our gloves, gown, as well as our goggles. Goggles at this point in time can be optional, so depending on the situation. Sometimes with contact, sometimes when there is a possibility of squirting, let's say body fluids, then might as well wear your goggles or face shield for that matter, right? For the diseases under, let's say, airborne, so we have here our measles, pulmonary tuberculosis, chickenpox, our disseminated varicella zoster. And for droplet, we have our mumps, German measles, meningococcinia, diphtheria, and pertussis. For contact, of course, we have there our polio, tetanus, MRSA, VRE, Clostridium difficile, as well as our infectious wounds to our patients. So if those cases are, let's say, occurring to our patient, please do take note of what kind of PP you should use in the clinical setting for our safety. Up next, we have our Hospital Memorandum 181 Series of 2023 Alert Level 1 PPE Protective Equipment. So for non-COVID areas, definitely we're going to make use of these two major items. And these are our surgical mask and of course our 70% alcohol. Not necessarily Green Cross alcohol, but as long as it is 70%, and that would be okay. Next, for respiratory areas, not necessarily COVID-19, then we have to wear all these materials. And for areas who will be assigned, let's say, healthcare staff in our hospital, once they're assigned to these areas, definitely they're going to make use all of these items in the clinical setting. Okay, so that is it for our hospital memorandum 101. Next, we have our points to ponder. So this is actually the last and final slide I'm going to share with you. So definitely for the requirements, no wearing of jewelries. If you are, let's say, assigned in the clinical setting, I know that there are some of you who really do love collecting jewelries. Now, if you do have lots of jewelries, please do not use it here in SPMC. Use it outside, because for us, we believe jewelry sometimes can be a reason why we harbor microorganism in the clinical setting. So we don't want to bring in, let's say, microorganism from the hospital to your respective abode, or from your house going to the hospital. So as you go on and have your clinical experience here with us, please no wearing of jewelries. All right, except your watch. That is it. Now, observe twofold team approach. So the good thing about athletes is that you will always be supervised by your clinical instructor and the nursing coordinator or midwifery coordinators and instructors. So that's the good thing. So of course, our clinical instructors will be under the supervision as well of our unit managers in the area of their assignment. So that's the good factor that we have here in SPMC, because we value education and preceptorship here in the hospital. Next is, of course, donning of PPE. So we don our new PPE before clinical exposure. Now, I am emphasizing this. It's because there are some individuals who are commuters. So meaning to say, riding from their place going to the hospital. And if you're wearing masks, please do remove them as you arrive in the hospital and replace it with a new one. Why are we emphasizing this? Because during the time period that you were traversing from your place to the hospital, you are actually bringing in a lot of microorganisms from your transport route. So of course, we don't want that one here inside the hospital. So change them as well. Next, we also need to remind everybody that we need to change our PPE or our surgical mask every 2 hours. That is the maximum utilization or use of our medical grade mask. But if you think about under suffering from the wetness of your mask, and that's so ill if you're going to make that one for the whole shift during the time that you are inside the hospital. The last one is of course doffing of PPE. So we doff our PPE in our anteroom. Normally our anteroom are located in our, let's say, place, or are, let's say, present in all of our special areas. But for those areas which are, let's say, non-special area, most likely there is an assigned area where doffing can be performed. Now, if you will be wearing, let's say, your PPE, then let PPE, there is what we call clean and unclean side. So normally the clean side is the back part of PPE and the inside part. And of course, anything that is anterior to your body is considered unclean. And of course, we doff our PPE carefully without haste. So meaning to say, we do not remove them hastily, because all the more you create irritation, or let's say create movements of your PPE, and if that PPE is contaminated with a disease which are readily, or let's say microorganisms which are readily suspended in the atmosphere, and that is most likely causing airborne. And if it happens, then most likely you will be infected with that kind of disease. And of course, we dispose our PPE to their respective uh, bins. So normally, if we are talking about a PPE, it should be disposed to our infectious bin, of course. So that is it. So let me end this one by saying that safety is not a choice, but a way of life.
All right. Thank you very much, Sir Jason. Do you have any questions or clarifications with regards to our lecture? No, lumipat lang ako. Actually, you may key in your questions sa chat box, no, or you may manifest, no. So I'll be also catering, no, those questions, whether be IPC or affiliations related na mga policies, no. So, is everything clear sa inyong end ba? May mga questions ba kayo? Can you give me a thumbs up kung okay na yung klarong-klaro sa inyo yung mga topics na binigay ni Sir Jason? If medyo mahihiya kayong mag-ask questions, you may actually key in your question in the chat box, no? I-key in nyo lang siya, tsaka we'll be catering to those questions later on, no? As we go by with our lecture. All right? So yun lang po. Yun lang muna. So at this juncture, so let's now move forward with our, again, don't forget to fill out the attendance no found in the chat box. So kindly click or tap on the link provided, no? Okay, so kung walang questions, so let's move forward with the affiliation policies. So I will share muna my screen, wait lang. Good day, students. So welcome to our orientation for the nursing and midwifery students. So before we start we'll walk you through with the objectives for this orientation. So at the end of this session, the students are expected to, number one, be aware with the rules and regulations, health protocols and standards set by the hospital and the CHED during the full face-to-face duty. And number two, be guided with the important documents needed, the personal and professional decorum, and the general appearance of the clinic instructors and the students prior to the start of the exposure. So let's start with your requirements, no, that will be asked by your that will be required by your clinical coordinators in your respective schools, no. So of course, each student is required to, of course, comply the following: fully vaccinated and boosted with COVID-19 vaccines. So we know that we have already I think majority of us have already been this with the COVID-19 vaccines, no? For example, in a group where it is a group of 10 students and also plus the clinical instructor. So within the 10 or with a group of 10, no, we actually at SPMC we accept about the majority of the students are vaccinated, then at least three or two of them or even four of them are unvaccinated, including the clinical instructor. So we have some considerations and we have adjusted that, but of course with the approval of our IPC chairperson. So okay, with number two would be flu and or pneumococcal vaccination. Well, let me just emphasize and or, so it could either be either or one, of the vaccination or both. The better, no, for if you could be able to be with vaccinated with flu and pneumococcal, and also hepatitis B vaccination. So this is actually a very common question that we have encountered here in the training office. Wherein many students have asked that do we still need to comply with the three shots of hepatitis despite of achieving a titer of greater than 10 now, because since you also have to understand that it is one of few of the requirements, no, prior to your clinical exposure to complete the vaccines, no, regardless of your titer. Of course, it is good that you have already if a person has already reached beyond 10, right? But for this is for your protection against bloodborne infection. No, so with that, you have to also adhere with the policy of the school, and also in our end, no, in SPMC, we just have to ask the copies of your vaccination cards, no. So of course, you also have to bear in mind that as the years go by, no, despite of receiving the three doses of the vaccines, however, as the years go by, it actually decreases its levels in our blood, no, fighting against the infection. Hence, we really need to maintain a high level of antibodies so that we will be able to be protected against this. So we also have the medical certificate showing to fitness to go on duly and healthy. So we actually get this no certificate from your school physician or even from different depending on the process, or even next school certified by the doctor. We also have the notarized assumption of risk release and waiver of liability agreement. You also have to accomplish the non-disclosure and confidentiality agreement. Now, you also have to think, basahin ng mabuti, mag-isip, at intindihin. You have to understand the context or the content of the assumption of risk. Because basically, dear students, no, you are entering a profession that has a lot of risks to it, though, with it, right? So in a hospital, whether with the community, nursing, or even midwives, nurses or even midwives are at risk for any potential dangers or harms that can be acquired from their, as a nature, part of the nature of their profession. So hence, we need to understand closely the content of the notary assumption of risks, no, so that you'll be able to also internalize and reflect know what could be the possible consequence before you sign the consent. And also the non-disclosure and confidentiality agreement, you also have to bear in mind that we are bounded by the Data Privacy Act of 2012. We are obliged, no, it is a law, so we are obliged to really protect the confidentiality of our patients, no, by means of course from their charts, no, even their identifiers, the HRN numbers, etc. No, So must undergo SPMC IPCU's orientation and the orientation of specific units. So actually, no, we also have um, uh, an IPC educator, no, which is Sir Jason Gray Doctor. So actually, he'll be giving us, no, a lecture with the IPC protocols, no, that is being practiced here in SPMC. Also, must provide their own PPEs, no. So, uh, dear students, please be reminded that you also have to bring extra paraphernalia, particularly the mask and the gloves, no, as because you may never know that you'll be encountering a lot of bedside care here in SPMC. So you need to protect your hands. So so that to prevent from soiling or any acquiring of any contact infections, no. So with that, you need to bring extra gloves so that you'll be able to do it properly and protect yourself, no, during performing rather the bedside care for your patient. You also have to log in the affiliations logbook, which is available in the area, and accomplish the electronic SPMC post-training evaluation after the entire rotation. So later on, I'll be flashing on the screen the links so that you'll be able to click or even to key in the URL for you to be able to navigate and fill out or accomplish the post-evaluation, because we really wanted to, of course, hear from you, dear students, your feedbacks, your experiences while you're having your exposure here in SPMC. So of course, here are the some of the reminders. So please, of course, take note that those being presented, no, bullets 1 to 5, you should actually, those set of requirements should be submitted to your clinical coordinators, to your respective schools. Again, so they'll be one to check it one by one, to check its authenticity, to check its correctness and its accuracy and other details, pertinent details. And with that, once they have verified that those requirements are good enough to, of course, for you to be able to have your exposure, so they'll be preparing now an affidavit of authenticity, meaning to say that specific document with which would certify that the following students, that the students have been listed in that documents have a authentic set of requirements. They are able rather to they are able to satisfy of the requirements prior to their exposure here in SPMC. No, so sa kanila ninyo ipasa ang inyong mga requirements, dear students, no. Of course, meron din tayong isa dito. We also have an additional requirement of which we also require a PHIC or PhilHealth ID, whether it's ID or if you're still 21 years below, and you are being declared by your parents as your dependents, so you may use their MDR. However, if you're already 21 and above, no, you may get a PhilHealth, no, through you may actually apply online, no, and be able to, of course, declare it as a self voluntary contributor to PhilHealth, no. So with that, also aside from the requirements that I have presented a while ago, you may also include PhilHealth ID or MDR. So here you go are the set of requirements. So you may take a screenshot of these links for you to able to navigate and be able to download the copies of the documents. Also the post-training evaluation. So once you finish your duties, please accomplish the post-training evaluation and of course provide us feedback. Next would be, of course, are the updates of testing. So testing is no longer required. However, if a student or the clinical instructor is experiencing COVID-like symptoms, so basically, so they are now required to undergo RAT. So it's the rapid antigen test or the RT-PCR for us to confirm whether you have COVID-19 or you don't have, or you have we have COVID-19. So with that, once you are confirmed with positive with COVID-19, so you'll be subjected to quarantine about 5 days. No, so okay, moving forward. So hopefully you'll be able to, of course, no, get some of the requirements. So those are the things that we should comply. So again, let's just pause, no, a bit, and I would like to ask our students, no, were you if they were able to get all of the requirements that they have listened to my lecture a while ago. Okay, let me ask the students ngayon. So please populate the chat box, and I would like to check, no, whether you have um listened to our lecture a while ago. So kindly populate the chat box, and of course enumerate some of the requirements to comply, no, so that you'll be able to be exposed in SPMC. Say, okay? Please populate or key in your responses in our chat box, okay? All right. It seems that few of our students, no? Thank you very much for the response, dear students, no? Indeed, you were able to listen to our lecture this morning. Okay, let's move forward with the health protocols and standards during RLE. So all student affiliates are to rotate only to the agreed upon areas with swab negative patients for a specified time period, and areas will only allow their entry with the endorsement from PETD office. Again, guys, you will be deployed, or you will be having your exposure in non-COVID areas. No, no worries. No, again, you will be deployed in non-COVID areas. Of course, with a go signal from at the office, no, so of course, considering all of the completeness of your requirements, no, you have satisfied all of the requirements, then of course you may proceed with your duty. Face-to-face rotations might be discontinued with the approval of the medical center chief in any or more of the following instances. Davao City on alert level 2, no, so at this moment, of course, we're no longer encountering spikes of cases here in Davao City with COVID-19. No, so thank God, no, for almost 2 years we've been experiencing these trends, no. Outbreak of infection within the hospital. Actually, the concept of the outbreak is not just actually being associated with COVID-19. It can also be with other infectious diseases, no, such as chickenpox, measles, or tuberculosis, as long as the numbers of the cases are going up, no, in the hospital, or even it's those diseases been crossing from one unit to another, then like beyond the numbers of patients having those specific diseases, and can still be progressingly has progressed and spreading around the hospital. So hence those conditions are already outbreak, no, signs of outbreak. Hence, you will be subjected. No, there might be at times that you are advised not to, of course, have your duty. No, because of the danger that might give you, or that might cause you. No, while you're having your duty here in SPMC. We're also abiding the policies from the CHED, Department of Health, and LGU announcements, no? And of course, if we see that it could endanger your lives, or particularly your health, no, and wellness, so we'll actually stop your rotations at SPMC. So of course, here are the following for the guidelines. So the student affiliates must procure their own PPE. So I have mentioned this a while ago, that aside from the contents of your paraphernalias, you should bring also in sufficient amounts of gloves, and also mask, no, for you to be able to perform bedside care, no. Also, upon the arrival of to the entrance of the assigned duty area, the clinic instructor will check the student's temperature. All students must have symptoms of COVID-19 will not be allowed to report and will be subjected to medical consultation. Again, if you are not feeling well, so better you have to, of course, tell your clinic instructor that you're experiencing COVID-19 symptoms, and so that he or she may be able to advise you to inform the school that you have not attended your duty, and hence you can take your rest, no, and to recover from your illness, no. Actually, it's better to, of course, you have to be conscious enough, and of course, be able to also put into consideration the safety of your patients and also your classmates as well, no, because it's a lot more dangerous if you'll be going to your duty, you're experiencing COVID-19 symptoms, you don't feel well, and that you just just have your duty, and with that you might spread your infection, your disease or your illness towards the other, or your to other patients, or even to your classmates, no. So please be mindful and conscious enough. Then of course the student affiliate can remove their protective equipment only when eating or as necessary with the approval of the clinic instructor or the SPMC staff, no. So based on our experience, dear students, now we have observed that few of the students, no, especially for those students who have duties, no, in the clinical area, particularly in the critical care units, the ICUs, or even the to some operating rooms and DR, no. If they'll be having their break, they actually go out from their units just wearing their